On Monday, March the 9th, I received a call from Dr. Stephen Wright, one of our physicians here in the hospital, and he proceeded to tell me that he had a patient that he wanted tested for the coronavirus. After a moment of shock, I said, Dr. Wright, you're kidding me, right? And he said, no, Erin, I really think this patient may have COVID. We need to get him tested. I then called the Department of Health and requested the test, because at that point we didn't have the testing in-house. It all had to be done through the Department of Health. They agreed that they would run a respiratory panel on the patient, and then if it was negative, they would do the COVID test. On Tuesday, I got a call from the Department of Health that the respiratory panel was negative, but they had decided they weren't going to do the COVID test because he didn't really meet the criteria that they were looking for at that time. I got in touch with Dr. Wright. Since the respiratory panel had been drawn on Monday, we had figured out that the patient had traveled to Mardi Gras. So Dr. Wright presented that new information to the Department of Health, and with his persistence, they agreed to go ahead and test the patient for COVID. So on Wednesday morning, as we were preparing for safety huddle, my cell phone rang, and it was the number from Little Rock. So I decided maybe I should probably answer it. So I stepped out of the meeting, and the voice on the other end of the phone said, Erin, this is Kat Flowers with the Department of Health. I need you to sit down. And I knew immediately what she was going to tell me. I told her, I said, no, ma'am, I know what you're going to tell me. And she confirmed that we had the first COVID positive patient in the state of Arkansas. I began to write down with very shaky hand the instructions that she was giving me about the next steps that we needed to take. When I didn't return to the meeting after 3 or 4 minutes, my boss stepped out, and I shakily wrote on the other side of the page, first COVID patient, and held it up for her to see. She went back into the meeting and pulled Peter Austin, our chief operating officer, out of the room. By that time, I had gotten off the phone with the Department of Health, and we were formulating a plan for how we were going to deal with this. We knew the people on the task force that we needed to gather. We knew administration had to be told. We knew the board had to know, and we knew we were on a pretty tight time frame to let those people know. We started gathering people together. We started dispersing to handle some of the different tasks that we had that we needed to accomplish. We were supposed to be back on a phone call with the Department of Health at 10 o'clock. Wow. I remember thinking, okay, I've got to go to my office. I ran to my office, grabbed my computer, grabbed a power cord, grabbed a notebook, and I remember calling my husband and telling him.
Oh, wow.
And I told him, and I said, I need you to know this. I need you to tell the kids, and I don't know when I'll be home. I don't know what this is going to look like. I remember texting my parents and my in-laws and letting them know, and that was about the only real chance we had. At 10 o'clock, we got on a call with the Department of Health, and they told us that we didn't have long because the governor was going live at 10:15, and they weren't real sure what all he was going to say.
And today, I've talked early today with Dr. Smith, and the Department of Health have confirmed Arkansas's first presumptive case of the coronavirus in Arkansas. I say it's a presumptive.
The governor went live at 10:15 and announced that a hospital in Pine Bluff had the first COVID patient in the state of Arkansas. Not long after that, his press conference didn't last long. We called a code orange, which is our internal disaster code, and all of our management staff met us just down the hallway in a large classroom that we were already beginning to set up with computers and telephones and things. We quickly had to start contacting people that had been in contact with patient zero. We were doing our own contact tracing. And it was at that point that we realized that some of them were already sick. Some of our staff that had worked with him over the weekend had already called in because they were sick. And so then we had to start making arrangements to get them tested. The Department of Health was calling with patients or family members of patient 0 that needed to be tested, others in the community who had been involved with some of his family members. We're fortunate that we have kind of a drive-through circle drive at the hospital. We knew we needed to protect our staff and our other patients, so we would garb up and go out and meet them in their car in this drive-through so that we could test them without having to bring them into the building. I remember someone made the comment, oh, well, we'll probably just be in the command center for a day or 2. And we ended up being there for the first time about 5 to 6 weeks.
Now, patient 0, he walked out, and I don't want you to give any kind of personal information about him, but he survived.
Yes.
And he was able to walk out. I think
I saw
it was
him in the grocery store a few weeks ago.
Did you really? That's great.
He
That's
eventually
awesome.
walked out. He was transferred from here to a long-term care facility via ambulance. We had a big celebration. We cheered and hollered and played music, and so excited that he had survived. That was, I think, probably something that kept us going, knowing that we didn't lose the first one. We went several weeks before we actually lost a patient to COVID, and so I think that was something that kind of motivated us to keep going. Once we got him in isolation, we didn't have another staff member become sick. You know, once we knew what we were dealing with, then we were able to put the precautions in place to protect everyone. And so I think that was a huge boost for us as well, that, hey, we are doing this, we're doing it right, and it does make a difference. Our community has been such a huge support as well, that has boosted morale and has helped us continue through this, what has now become an almost 2-year fight.